So, good evening and welcome to our Think Tree Hub live tonight. I'm absolutely delighted to welcome Owen Lewis of Born to Move. Hi, Owen.
Hello, as if by magic, I seem to pop up onto the screen. So hello, good evening, everybody.
So, this live, as you can see, is based on the core, our central anatomy, what Owen calls the centre of our kinetic chain, or at least quote. That's a quote you use in your new book, which I must say I have found absolutely useful and perspective altering and three-dimensional, absolutely three-dimensional, not two-dimensional. So what we're going to go through tonight, I think, is going to be immensely useful to anyone who works on the body, anyone who holds movement classes, and really anyone who does sport of any kind and thinks I really ought to train my core. I think Owen's going to let us know maybe a different aspect, a different approach is going to be the most effective for you to actually achieve your sporting potential. So, Owen, as you can see, it's called a science-backed approach to exercising, understand our central anatomy. Owen has studied with the absolute leaders in the field here and around the world. And you'll notice I've mentioned soft watery bits, solid rigid casing. And again, I think this is something that Owen is really going to open your mind to if you're stuck in the kind of the plank is everything mode, which we can have. So join us tonight. We're going to unlock a more complete understanding of our central anatomy with Owen. I'm going to hand over to Owen in a second. We've got a Q&A afterwards, so please pop your questions in the Q&A box. If you prefer to put them in the chat, that's fine too. And Owen's going to answer all your questions live afterwards. So enjoy. Owen, over to you.
Thank you, Rosemary. And like I say, thank you for everyone for coming along. Yes, the kind of aim of this, as I try and screen share and talk, is to discuss a little bit as to what I've been writing about in this book that hopefully you can see on the screen there, rather than trying to flog it. I'm not trying to sell the book, but I'm definitely trying to kind of sell the ideas, if you like. But it is a great privilege to be invited to speak about this. So thank you to Rosemary, to Think Tree, and a really big thank you for all of you for bothering just to try to know a little bit more today than you did perhaps yesterday. Whatever your motivation, your interest, I think, speaks volumes in itself. So thank you so much from that point of view. I want to spend just a few moments kind of putting the book itself into context. Context really kind of hopefully allows us to understand things just a little bit more, a little bit wider, and understand where I'm coming from, perhaps, and see behind the scenes of just the words that I happen to scribble down. So I have to therefore make some time to take the opportunity really to mention what else I do. Probably the biggest thing is the collaboration between myself, James Earls, who you may have heard of, all of his brilliant books and his workshops. Together we offer a very comprehensive worldwide training in movement-centered bodywork. And it's a way of educating your hands about the body in various different ways, including the books and including the workshops particularly. As ever, there's the various ways of getting in contact or staying in contact with me. So please do so, however much you love or hate social media. I'm not very big at talking about myself. I don't particularly enjoy that aspect of what I need to do sometimes. The picture that I so often use when I'm talking about me is this one, and I'm actually that speck right in the distance there. You see that little speck? That's me. And it just proves that I do row is my kind of love of movement, has progressed through the years. I've got into it more recently in the last 4 or 5 years. I love rowing, love getting out there and moving ultimately. The other picture I've started to use is groups of people who I end up teaching to. This was a group I taught to in Shanghai. Again, it's like, where's Wally? You know, where am I? So I'm a rower, a mover, a writer, an educator. But I think first and foremost, I see myself as a clinician. I'm here in my clinic today. And as Rosemary mentioned, I've been taught by some of the best people in the world, principally Diane Lee, a Canadian physio and outright genius, in my opinion. So if you hear anything about Diane, you know, try and learn from her. Stunning individual. And the other person who I've got to sort of tip my hat to was Thomas Myers of Anatomy Trains fame, a concept that I taught and was fascinated by for many years. And that's really taken its natural conclusion. And from there, and many other concepts, we've developed this whole Born to Move concept. Teaching Born to Move has given me the incredible opportunity of running around the world, teaching these sorts of ideas. This is a couple of photos I took the last 2 weeks, one in Budapest, you can imagine which one that is, and one in Amsterdam. And this little chat is part of a longer and much more practical workshop. The next one of which is happening in the UK. The next UK one is in November under Functional Links, so you're more than welcome to come along to that, hear a little bit more, and get the practical aspects of this course, this workshop. But like I say, most of the time I spend my time here in my clinic. This is the other view from what you can see from on the little screen today. And here I see everyone and anyone from kind of chronic pain sufferers to Premiership footballers and elite athletes. So lots of different people, and that's really where my expertise lie. When I'm not in clinic or teaching or rowing, I will almost certainly be found reading. I absolutely love books. I have placed them on a pedestal. So much so that daring to attempt to write a book was a very scary prospect. You love YouTube, look at that, isn't that great? Books are a complex thing. They are simply constructed letters, sounds that produce words and ideas, and we work them together for meaning. But of course, it's the words between the words that I think really tell us really so much more. So as I say, being asked to write a book myself was very scary, and I was placed in a position of doubt. It was kind of like that horrible picture, scary photo for many of us, yeah, being set an exam question. You know, the publisher said, the core, write a book on the core, now discuss it. It's like, oh my gosh, how scary is that? And I was doubtful that I could do this. And as soon as I realized how doubtful I was, I actually was returned to my happy place, back to my clinic. And I was in a much calmer place. I was allowed to be doubtful, because in clinic, I know nothing. And I actually try to embrace doubt. And I think that being okay with not knowing allows me the curiosity that is necessary to ask my principal question, which is why. And often that question of why is, why are they in pain, or why are they not performing at the level that they need or want to? And that allows me to then ask more questions, to discover and work with my clients to focus on the cause of their pain versus just focusing on the symptoms. So my first question that was concerning around the core was, what the hell is it? I thought, like many people, that, oh yeah, of course I know what that is. But being asked to write something directly written down, suddenly that answer becomes a little harder. But ultimately, as I found out, with the stress and the tears that were necessary to conjure up the words, I found it equally an incredibly rewarding process. So lots of research told me that fundamentally the core is hugely important. It's hugely important, but everywhere it seemed to lack a very clear or any certain definition. It seemed to be everywhere and indeed nowhere. It was everywhere. All the magazine articles, the social media posts, every gym you pass seemed to use this term. So it's commonly used, and yet it is often very poorly understood. It seems to be nowhere. Yeah. Anatomically, we don't really have a core like an apple core. Our center is not strong and fibrotic like an apple core. So it is nowhere. And of course, my mad mind went to this Taoist idea that it's actually the emptiness of the pot, of the vessel, that makes it useful. But that the core is more, as we generally understand it, is more to do with the pottery of the pot, if you like. Now, our center is not fibrotic like an apple core, nor is it quite empty like a pot. Our apple-like core is indeed fluid. It's full of a group of visceral kind of water balloons, if you like. So we realize that for a healthy visceral system, we need movement. And this understanding took me away from the kind of standard idea of a solid core that is stable and perfectly immobile towards something else. So I was still confused. And by core, we often don't mean really core, we actually mean equator. We don't talk about the center of the Earth, we're talking about the lines of longitude and latitude, and including the equator. So that maybe gave me a bit of a map. But I realized that by the core, we mean the circumference. But to explain this, I needed a map, not of lines of longitude and latitude, but something a little bit more accurate. So the map of the muscles that I was talking about really basically arranged a little bit like the Union Jack flag. And this flag, of course, is made of fabric, and it's adjusting to the currents of the wind, the vectors of the forces, and it does not represent all of our muscles, but it is a nice starting point. The Union Jack flag, like I say, it's too simple to fully represent the core. Better maybe would be an image such as this one by the artist Bridget Riley, reminding me of that kind of almost cross-hatching of the external, internal obliques, transversus, and all those other muscles that together create that parabolic curve that was made so famous by the likes of beautiful people like Marilyn Monroe, whose beauty to me is to the core within the social context. So to understand the core, let's put it into a wider context before we could get very precise into the muscular system. We need to put it into context to understand it. So another aspect of the core I repeatedly came up against, if you like, in the research, was coupled with this other term of posture. Good posture is very synonymous with a good core, and certainly within popular opinion, I think that's true. The idea of good posture has been around for a very long time. Here's this quote by Ovid, and he talks about how the animals are on four legs gazing at the earth, while the humans gaze up towards heaven in some because we're much higher level creatures than the mere cow. It's an idea that posture is actually a tale of morality, good and bad posture. Good and bad is a moral argument, not an anatomical one. Posture has also been linked to pain, and common ideas are that back pain is linked to a particular way of sitting. And yet there is actually no evidence that posture and pain are linked. There are plenty of examples of people who sit badly and have no pain, and people who sit or stand correctly and are actually in pain. We've all experienced those people. It's a bit of a sad, somewhat sad joke to think that if we sat in this position of that guy at his desk, we sat perfectly positioned for hours upon hours every day, the result would be pain-free. That idea seems to me a little bit silly. And perhaps the closest relationship to posture and the core is the invention of the corset. Yeah. Very popular, obviously, in the 1900s. We could see the corset as a tool of oppression, of control, and of sexual exploitation. The core is, I think, literally forces women to conform to social ideas dominated by men who, by the way, were actually making the corsets. Today, the corset is rarely a piece of clothing, but today the corset can or may have perhaps been moved into the world of exercise when we talk about a solid core. We're trying to conform to a particular stereotype. And we're often taught to brace, we're brought belly into the spine and even to lace up the core. Have we, I wonder, internalized the corset via diet, exercise, and even surgery? We're creating potentially a sinister relationship with our bodies. And this is not just for the women. Men, you have, or we have, the potential for such a relationship or negative relationship with our bodies as well. I can't help but mention the plank. We could ask the question, how long should you be able to hold a plank? Well, for Daniel Scally, it was somewhere around 9.5 hours. That's crazy, isn't it? That's the world record. I don't think I can do anything for 9.5 hours. I don't think I can even sleep that long. But for him, it was functional. This position was no doubt part of his training. But for others, maybe they have to hold a plank for longer. Sorry, bit of a dad joke, but got to be said. So a plank's a good thing. Well, if you want to get good at holding a plank, then do more planks and you'll get better at them. But I would suggest that we make it a little bit more dynamic, a little bit more fun, perhaps playing catch while in those positions allows you to have some fun out there. You can see the concentration on this poor girl's face. So ultimately, what we came up with this is a much more fluid definition, a definition that's able, I hope, to adjust and respond to the chaotic world within us and without, and reflects ultimately our watery core. This, I hope, enables our training to enhance the control that's necessary, as well as the efficiency and fluidity of effortless, beautiful movement, be it on a surfboard or elsewhere. I mentioned rowing, so I have to put rowing in there. It's kind of a necessity to me. The functional core, therefore, needs to be at least two things. It needs to transmit force. You can see this guy, this is Mahe Drysdale, Olympic gold medalist, pushing the boat along. He's pushing through his feet, that's transferring that load through the torso, through his arms, into the handles, into the oars, and ultimately pushing that boat along. But it also needs to be a mobile adapter. It doesn't need to be just solid. It also needs to move and adapt to our changing environment. It's unusual for this rower to be on such perfect glassy water rather than the normal ripples and waves that I certainly get. Gary Gray of the Gray Institute coined the term mo-stability, the mobility and stability pushed together. And really, this is the role of a functional core, as I'm seeing it. Here's a paradox. Our anatomy text talks a lot about the action of muscles. The paradox is that in that picture, we have asked the dead guy about movement. We've asked the inanimate about animate. Yeah. And the exams that I certainly sat, asked things like, well, what is the action of the rectus abdominis, the six-pack muscle, yeah? And the correct answer for the exam is flexion of the trunk. Tick, well done. But if I change the question slightly and I started to ask about the function of the muscle, then that confuses us or changes our perspective a little bit. The action of the muscle is to flex the trunk. So how do we train it? Well, we do sit-ups. But the function of the muscle is perhaps different. What is the muscle doing on a daily basis? If it's doing sit-ups, then sit-ups are excellent training methods. But something that's more common would be like going for a walk. Here, the rectus abdominis is actually decelerating or controlling the extension during that movement, which is the exact opposite to the action, and quite a common way of training this muscle is confusing potentially our muscle or our neural system within the sit-up, when actually we're asking it not to flex the spine, but to decelerate the extension. So from that, we've thrown out there into the book a whole load of different exercises and ideas, things like using elastic band to increase the workload, the deceleration part of that exercise, catching a ball overhead to train the very important timing and the control aspect of rectus abdominis amongst other muscles. We can't just divide one muscle, but it simplifies things. Similarly, using things like kettlebells and those swing actions, all in the sagittal plane. But what if we then threw some ideas into the frontal plane? So here we have somebody in a sit-up type position, waving their arms left and right in terms of those side bends and working through there. Here she's throwing a ball to work on the transverse plane of the rotations. Now, this book is a book of principles, and understanding these principles really does, I hope, allow you to play with the actions and ultimately to develop your own exercises. So many of you run. If you run, I don't know about you, this is a real track. I was amazed. I was like, wow, that is the track that I want to run on. It actually exists. Perfect conditions. Maybe you're a runner on a different perfectly flat but maybe slightly dreary repetitive treadmill. Now, I think training should reflect our reality. If that's your reality, then that's wonderful. My running generally looks more like this. This is the conditions I find myself running on. I wonder how your roads are doing at the moment. And does your training reflect our difficult and ultimately unpredictable reality? That's my challenge. So, for example, this guy as a runner, could we include an exercise that's a little bit more challenging and ready for his experiences outside? You can see how he's lifting this weight, but it's not the same weight both sides. As a result, he's having to push with his right arm and pull down with his left to keep the horizontal bar balanced. So we could consider, well, that's interesting, considering the work of the latissimus, say. You can also see by lifting that right knee that his pelvis is rotating to the left and his thorax is having to relatively rotate to the right, which is causing a different workload between the external and internal obliques, or quadratus lumborum, and all sorts of different muscles, obviously, all working there to control those actions, including the tensor fascia lata, connecting down in through the iliotibial band. And we could also talk about the left foot and how that's controlling the relative pronation. A whole lot of forces are being transferred into his system, and he's having to deal with that. And part of that is going to give him a much more adaptable and reactive core structure. We're not going to stop there. We're going to say, well, instead of the good old perfect squat, I'm going to suggest we add some variety and some adaptability to our training, to allow our body to be ready for life. So there's our standard squat, but why do we have to have our feet that position? Why couldn't we do a squat that was a little bit wider, or indeed a little bit narrower? And why do the feet have to point forwards? Could they be externally rotated or internally rotated? Could they be a combination of the two? Could we change the weight distribution that's coming down? There's a whole load of different principles that we can start to play with, from a conventional squat into something that is directing the forces into different parts of the system to ask for different levels of work rather than the same old repetition. We're not going to start at lunges. Of course, I could use a whole load of photos from the book here, from some weird and wonderful press-ups. But the key important part here is that within the relatively safe environment in the gym, I want us to be able to be given the right to play with movement, rather than dictatorially doing the same old exercise over and over again. Dogmatic rote learning of correct movements, I have a real problem with, because my clinical experience has taught me that correct movements very often build fear that I'm not moving correctly. I might actually move incorrectly. And the indirect consequence of that, I found, is a lack of movement, or a stiff and careful movement. Instead of that, I want to better understand the principles of movement and then go play. I want quality through intelligent effort, but ultimately we're going to get that from explorative, interested, and safe play within the movement parameters given. So I do hope you enjoy the book. This is just obviously a snapshot of some of it. I do hope you enjoy your own movement as a playful way of learning that continues to your own understanding of this incredible system that we call the human being. Please do stay in contact. Visit borntomove.com, visit all the social media sites. There's lots of information and ideas that we are throwing out there for you all. I want to say a big thank you again for the invitation, and I'm going to offer this now out to any questions that you have, not only questions, just curiosities and thoughts that you may have. I'm very happy to attempt to answer. So thank you. And I will stop sharing as well.
Thanks, Owen. I have my copy of the book here, and I'm going to say, if you will by now have an idea of the playful nature of the book, but also of its stimulus, right? It is the absolute antithesis of join the dots movement and join the dots exercise and join the dots understanding of how the body works. So I absolutely personally recommend it. So looking at Q&A, the first person asked, and I think you might have covered it a little bit earlier, but it might be a good idea just to go on a bit more, because there's quite a bit in the book about exactly why we need this fluidity and movement. So somebody's asked, why do we need a movement for our core?
Yeah, that's great. It's an interesting question because I think in some ways the most important part of that question is a movement, singular. It's like, well, I would go, well, actually, I don't think we kind of don't. You know, if I almost call the book "There's No Such Thing as the Core and How to Train It." Didn't really work, but it was almost going to be that. Yeah, we don't need a movement. There is no perfect exercise for any element in our whole system. Yeah, so it would have been certainly possible for me to turn around to and just create a huge bank of exercises that we could have called, oh yes, this is the movement for the core and this is the movement. And ultimately, it's actually harder to think of a movement that isn't a movement of the core. Yeah, so it sort of turned that on its head in some ways. Ultimately we move as one system, and I don't want to be guilty of trying to come up with an exercise that is what's the word, individual, an individually specific muscle exercise. Within the clinic environment, yes, it's sometimes necessary to train individual muscles, but that's generally not necessary if quality whole body, whole patterns of movement hadn't at some point been really neglected. So I want to advocate, good quality, open, fluid, continuous movement, realizing that yes, we can focus on different aspects, and the core could be one of them.
Thank you. And I think some of the points that you were making earlier on, in fact, that we need the core to actually keep our internal organs healthy, and which is very much part of yoga.
Yeah, and one of the things about, certainly, I mean, yoga is certainly part of that, or really, I would say any movement that has that kind of playful, fluid nature to it, rather than, sometimes we are trying to do it correctly, and we kind of could potentially get kind of robotic about the in those movements. So that's the struggle I have, rather than saying, hey, let's play with this, let's enjoy this. And that changes, I hope changes the feel, if you like, of the movements that we can have.
Got a question, actually. I'll come to this one first because it is related. And Angela, hi Angela, I haven't seen you for a while, but be great to catch up. So Angela says, what are your thoughts on belly dancing and yoga as a way of utilizing the use of our core? So it's kind of what you just said, but maybe going into belly dancing as well. And
yeah, I've not really, I mean, I don't know much about belly dancing, I admit. Maybe I should do some more research, but yeah, I mean, my limited knowledge on that would be absolutely, because if that's the dance aspect of that, the fluidity, the grace, the rhythm of working with the music is all going to have a real great resonance to our system, to the timing, and obviously within the visceral system particularly, I think. So yeah, absolutely. I see no reason why not, especially if it creates a little smile. That would be particularly useful.
And Jane says, can you just repeat your definition of what the core is? I think she kind of means exactly which parts of the body you would consider to be the core, even though we can also say it's almost everything, but typically, conventionally.
Yeah,
conventionally.
absolutely. Well, okay, so I mean, there have been, there's people out there who have talked about the core of the foot or the core of the shoulder, and that has, that's a really interesting area to dive into. So I absolutely would recommend finding out, looking that up. But conventionally, most people agree that it's sort of somewhere in around diaphragm, so to the pelvis. So pelvic floor included in that, transversus, rectus abdominis, erectors, QLs, internal external obliques, psoas, the whole package in and around there, being that circumference, if you like, of the standard answer for the core. And because that's so commonly used and kind of thought of, kind of certainly in lay person's talk, we're not going to get rid of that to say, oh, well, actually, it's higher or lower, or it's more or it's less. It's like, that's what we're going to have to deal with my clients coming and going, oh, I think I need to work on my core. It's like, well, we don't need to get oh, actually, it's this or it's that. I want to deal with that concept as it lives, as it breathes in reality, and then just sort of fine tune it a little bit more.
Okay. Angela says that belly dancing is far more fun and a really hard workout. I've known people who've done it, and they do say that.
I will look up for the next class.
Yeah. And I think it's almost what you were saying, that you can almost see it as like a squeeze box.
Sure. Yeah, absolutely.
Expansion and opposite of expansion and coming together. I love the way, I absolutely love the picture that you showed. I can't remember her name, the artist, but it's the whole idea of the lines of force and running through and different angles, and just in a way that you see when you kind of play around with tights, if you're a
yes
and you see the lines of force shifting and changing just to accommodate everything.
Absolutely, and the lines of the musculature really do show us what the lines of force are. So those forces of vectors that we're dealing with day in, day out are shown in our anatomy, and it works both ways. And yeah, you're absolutely right. The image I think you're mentioning is the Bridget Riley picture. Yeah, and that was I do like art, and it was one of those moments where I walked into an art gallery and went, oh, I'm gonna have to put that one in. Not another image, but gonna get another one in there if I can. So yes, there's pictures. Sorry.
Yeah, Jane says, coming back to her earlier question, do you have an opinion on whether abdominal reflexology would be useful for the core?
I have no reason to suspect it wouldn't be. Yeah, I mean, I have a lot of time for reflexology, for a whole variety of aspects and elements within that. So yeah, I think it's the usual thing. If it's the right tool for the right job, it's brilliant and it's perfect. And I think ultimately the really good practitioners of any discipline know not only what they do, but we all know our limitations. And then we can say, yeah, for that individual, this, I do have the tools that will help somebody. But for somebody else, maybe not. So for one person, abdominal reflexology would be absolutely perfect, depending on what they want. For somebody else, it will be the worst thing in the world, perhaps. Well, not about the worst, but certainly less useful, let's put it that way.
So it's understanding the principles of when to apply it and when not to apply it, coming back to your whole, thought. We've got another question, and this person says, thank you for asking this. I have a long history of thoracic back pain, which I managed by twisting. Now I wonder if I twisted too much for too long and overstretched the ligaments instead of working on strength. Maybe I'm too flexible and very weak. Any thoughts on twist and thoracic back? Thank you.
Great. Yeah. So thanks for the question. Yeah, there's lots of, I wonder if it's this, I wonder if it's that. And the short answer will be, well, actually, I don't know. And again, it kind of goes back to that Socratic idea of I know nothing, but I'm be curious to find out, because yeah, there's certainly evidence out there that says that for example, I don't know if this is true for this individual, but if the pelvis is rotating to the right and the thorax is rotating to the left, yeah, so there's a disparity that kind of creates a twist, a tourniquet, a squashing down of those two places. It's like screwing the jam jar lid, and when you screw it, it goes down into their system. That can certainly disrupt not only the viscera within, but it can also create pulls, and different levels of pulls, different vectors of force, if you like, through different musculature. And that could certainly cause thoracic back pain, or knee pain, or shoulder pain, or really pain anywhere. And then the question would be how do I unpick that? How do I take that rotation, if you like, out of their system? Now, if it's a strength issue, which is what alluding to there, if it's a strength issue, then yes, it could be a lack of strength in one structure or relative to another that could help to reduce that rotation. The ligamentous system, there's some really simple tests that a good body worker will know to be able to just check that the ligaments are intact and are doing their job. I find that instability in the ligamentous system is actually less common than I think is often portrayed. A lot of people are saying, "Oh, it's an unstable lower back," and actually you go do the test, and it's really not, a lot of more times than not. So there's that. And then in terms of flexibility, well, flexibility and weakness he's talking about, and again, yes, it can be to do with that. The real fun part of this within, from a clinical point of view for me, is that my next question would be, well, is the pelvis creating the rotation in the thorax, or is the thorax creating the rotation in the pelvis? Which is it? And if it's, for example, the pelvic twist that is causing the thorax to react to that, then my next level question will be, well, what's affecting the pelvis? Is it the foot? Or is it the kind of guy wires of the pelvis? Is it the piriformis, the rec fem, the what is it? So this is me in clinic now, kind of getting my detective's hat on and trying to piece that thing together. So it's a more complex answer because it's a complex system, which makes it much more interesting for me. But it means that the answers I give are always, I don't know. But there's a curiosity, and there is a logical system that we, ultimately at Born to Move, we teach this. So that's why I know it so well.
Right. Well, Jane says thank you, and I think we gathered this, but the attendee said that he used twisting to release the pain in thoracic pain, but I think that was contained in your answer, actually.
Okay, sure. Yeah, and it is interesting when we find a twist takes them out of pain, so that gives us a little bit more kind of information to then sort of start to again unpick where that clause is from that point of view. So yeah.
Okay, and Dano asks, hi Dano, she says, do you find with spinal injury patients, inability to exercise, weakening of muscles can cause mid-back and chest pain?
Not all the time, but that scenario certainly can play out, absolutely. I wonder spinal injury patients suggesting they do have pain already, but certainly weakness in the musculature. What typically happens is that then we we'll kind of use or utilize the ligamentous system. We kind of drop into that because the muscles aren't doing their job as well as they could. So then the ligaments start to get stretched. We start to push into the joint capsule perhaps, and that could certainly create the discomfort that they're experiencing. From my point of view, I will always go back to, you know, the knowledge that we have of pain and pain science and so forth. You know, we know now that pain is a really poor marker of success within the clinic. Yeah, you know, people just go, "What the hell is pain anymore?" It's complicated. It really is, and so I will always be going, well, okay, let's talk about position. Let's talk about biomechanics improving, things like that. Some very tangible, solid ways of measuring success versus do you feel better? Well, they might be feeling their pain because of a fear factor. You know, I'm scared that I have a spinal injury. You know, I've been diagnosed with a spinal injury. I'm now fearful. And fear, we know, generates a sensation of pain, a threat response. So there's a lot to unpick in that, but certainly certainly there's potential for some truth in there.
Okay, thank you. We've got another question which says, is there any difference in core for men and for women, bearing in mind that women have to carry sometimes very large breasts?
Mm-hmm. Yeah, absolutely. Yes, is the short answer. But I also don't want to be saying, you know, there's never and always. You know, it's to say, you know, there's the fundamental musculature is the same, basically. Of course, there's slight differences. Where not only, you know, it's the position of the weights of the breasts or the gut as well as another one. You know, you see some people it's very much out in front, other people it's much more like a spare tire. You know, and that weight distribution, the positionings will have contributing factors as to where that dysfunction, whatever that is, maybe pain, actually manifests. So yeah.
Thank you, thank you. And we've got another question which says, can laminar tear of the supraspinatus be healed? Are muscles able to knit back the tear?
Okay. I like the specificness of that. One particular muscle, I wonder why. So potentially, yes, is the short answer. Yeah, there's likely to be levels of scarring. Therefore, we'd be curious to see not only does it knit back, you know, over with time and good rehab, but you know, how is that knitted back together? Often that's a sort of scarred area, and we know that scar tissue is very fibrotic. It doesn't move so well, and so we can really sort of improve that with good clinical practice. And my other part of the question would always be, well, why did it tear in the first place? And is there an underlying imbalance, something else that we can address so that we can reduce the amount of forces into that particular area so that there isn't the loading, the vectors of forces into an area that is now, you know, scarred and fibrotic, and actually it can be, you know, mitigated in terms of the amount of effort, if you like, that it's doing there.
Brilliant, thank you. Just for people who are very much working hands on the body, are there any insights that you think you gained through researching the book in terms of palpation and where to work on the body?
Yeah, so I've been very well with the research and the writing. I've been very aware that every time a client walks in, it's not about the core, and I was very careful that I wasn't doing that because, you know, we're all biased. and my bias could very easily change what I was doing. So I was actually doing the reverse of that and saying, well, I'm learning lots, but let's try and put that to one side, and conduct my clinical application and my clinical practice as well as I could anyway. But it certainly gave me you know, you mentioned the three-dimensional aspect of or the idea behind the book, and certainly gives me a much clearer understanding, I think, of the three-dimensionality and also the complexity of the human body. You know, complexity theory is a theory I think we should all know a little bit more about, and gaining some understanding of that and appreciation of that makes me just go, wow, this is an incredible system that we get to work with, you know, with other people, with ourselves, and that's just been and continues, and I'm sure will continue forever, really, to be a really interesting canvas for my for my explorations.
And would you say that really the core at any one moment in people is precisely where the line of forces need it to be at that particular point in time?
Yeah, I mean I don't know if the position changes, but certainly the activation of you know, people often talk about you know, we've got to activate a muscle and can switch it on and all of that, those ideas, and that's certainly synonymous with a lot of the kind of core stability ideas of bracing and things like that. And you know, I make the point of, well, if you were to clench your fist and then hold it there and for 2 minutes, 2 days, 2 months, how's that muscle or muscles? They are now fatigued, weakened, and stiff. And if you ask that to then react very quickly, it's going to struggle if it's been contracted and held tight. So a lot of the time we are actually in that fearful, braced state that a lot of, you know, again, in my clinical experience, it's often turn around to someone and say, no, it's all right. You can relax. It's fine to slump and relax on the sofa at the end of the day. You know, we can switch off. It's fine. We don't have to be correct and rigid, because that creates rigidity and a lack of strength ultimately in our system. So having that adaptability of switching on and off is really important. And we've somehow forgotten the off part of that argument, I think. Not
Yeah.
always, but, yeah.
And it is perhaps again just applying principles, because I think one of the key messages of the book, just apply principles. Don't do anything by rote, because that way it's just going to be a disaster.
Hopefully not a disaster, but yes, I absolutely get your point. And yeah, I mean, you know, the protocols, the rote learning, all of that have been to a greater or lesser extent based on the average individual. And I've never met the average individual. Until I do, I will sit in this lovely state of not knowing again, and therefore reacting to the individual and saying, well, we've got to train the individual, we've got to treat the individual individually, not as an average conglomeration of a subsect of research guinea pigs. You know, I have a lot of time for research, but I also see the difficulty in the gold standard randomized controlled trials. You know, when I have to deal with you know, n=1, I have to deal with the individual singular. So it's quite a different situation.
Wonderful. And what would you, or at least what really surprised you most about the core when you were researching the book? What really, where you just went, wow, I never saw this before?
Sure. I know I never saw it before, but it was the fights within the research. You know, some people are really strong on one side of the argument, and somebody else is really strong on the other side of the argument, and kind of diving into that world for a little while was not that surprising, because I've kind of been there from when I used to lecture at university a little bit, but it was still quite surprising to see quite how absolutist we still are. To me, you know, I really like the work of Immanuel Kant, who you know, who does, you know, sort of moves away from that whole certainty aspect. So so yes, that's probably the thing that stood out more than anything, really.
Thank you. So again, for body workers, what do you think will be your key message to them when they're working in clinic?
Number one is listen. It has to be. We have to listen to our clients in as many different ways as we can. So yes, listening to their story, the words behind the words, listening through our hands. Our hands are such brilliant receptors of information. And the more we can listen, the more we can be led by our clients, we are going to learn so much more. And then the other part of that is to hold on very strongly to realizing that as a practitioner, as a clinician, you are the expert in the room. You do know your stuff, and you do know more than 99% of your clients. And as a result, I would always say, you know, go after the cause, find the cause, don't go for the symptom. We've tried that. They come in with a bad shoulder and you rub their shoulder. I said, well, hold on. They've now self-medicated. They've still said, well, treat here because I'm the expert. No, you're not the expert. I'm the expert. It's because of a thoracic rotation, a pelvic rotation, or something else. So yeah, listen, be open, and hold tight and strong to the realization that you are the expert. You do know your stuff.
We have got one more question. Interesting. I think again it's something you allude to in the book, that the link between the mind and the body. So the question is, these days we hear a lot about weak core. It's true. Does weak core mean a weak mental core? In my nana's time, nobody talked about the core, and I wonder if people in the past had better core. They certainly worked more physically.
Yeah, I'm not sure about the mental core aspect, but certainly if we start talking about, you know, some of the, and there's many, but differences from now to the past, yeah, I mean, it's very well documented. We have generally a more sedentary lifestyle, and that more work is going to create more strength, and perhaps that is why we're talking about the weak core. And maybe there is, you know, there may be some truth in that. We also know how, you know, the longevity of our life has increased. There's a lot of good things that happen now compared with in the past as well. So we don't want to, I don't want to put rose-tinted spectacles on and think that everything in the past was perfect and lovely. Yeah, and realize that actually it was pretty tough, and I know that I and many of people have got a pretty good life. Even if we have to moan about sitting in front of the computer screens too long, it's not like going down into the mines as my forefathers certainly were doing. Even if they had a stronger core than me, I don't want to be doing that. Thank you very much.
You remind me of one of my great grandfathers who apparently was incredibly strong, ran a farm, also went down the mines in winter, and would happily throw somebody off his land. I mean, didn't make him a great person.
Sure. Yeah.
If we've got no more questions, this is your last call. I am going to say thank you so much for Owen for coming and inspiring us and encouraging us to take a different, more fluid view of the core. as a thing of movement, not a thing of static strength. Yeah, strength in movement. There's a line there that I know, and I just can't. I can't get at it. Anyway, Jane says, "Thank you, Owen. Very interesting." Yeah.
No, thank you so much.
Yeah. So lines of force, everything. Transmission of force. Best way to look at. So Justin, let's do this. We'd go to that. Team slideshow, thank you. Okay, so just for anyone, I've put on there a QR code, so if you're inspired, I know Evan said he isn't flogging them, but I recommend it as a resource and a stimulus. And if you want lots of pictures of people doing exercises in a really, really creative way, it's worth it. Plus an exploration of the main muscles as well. It's all in the book. And if you want to know more about ThinkTree Hub, you can find us at thinktreehub.com. And if you want to know more about Born to Move, you can find them at borntomove.com. And again, thank you. Hope you had fun tonight. Again, thanks again to Lewis, to Owen, for coming and sharing with us so magnificently. Have a great evening. Thank you very much, and goodbye, everyone.
Bye. Thank you.